My name is Azita Amiri. I'm a professor at the University of Alabama in Huntsville College of Nursing. I've been doing environmental health research and education for the past 15, 20 years, and I'm so glad to be here with you. I will lead Module 9, Health Disparities and At-Risk Population. In this module, we will go through some terminologies first, and then look at the health disparities framework, and also move toward defining at-risk populations in our communities. Starting from risk terminology, EPA considers the risk to be the chance of harmful effects on human health or ecological systems resulting from exposure to an environmental stressor. The stressor can be physical, chemical, or biological entity that should have adverse effect on humans and ecosystem. Looking at other terminology, social determinants of health, that has been tremendously out there for different topics and different professionals, including nurses. So social determinants of health are the conditions in the environments where people born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And on the right side of the screen, you'll see a model that is from Healthy People 2030, and it shows all these components of social determinants of health, and they are interacting with each other and influencing the human health in the middle. Other terminologies are health disparities. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Health disparities are significantly associated with social determinants of health. And then we have at-risk populations that are classified as populations that for a variety of reasons are more vulnerable to an environmental exposure and its adverse effect than other group of populations. Here we have brought pregnant women, children, adolescents, farm workers, elderly, environmental justice communities, low-income communities, and Latinos. But this is not an absolute list. So in different situations, for instance, in public health emergency, we might have different definitions or different at-risk population than the current or normal public health situation. Or in different countries, we might have different population or add more community, more population, at-risk population to the list that we have here. So this list is not absolute, but it can be changed. Those are just some examples to bring to your attention that because of such and such and such and such, this population is at risk, which we're going to go through them group by group later in this module. Another terminology is National Institute on Minority Health and Health Disparities Research Framework. This framework is considered a roadmap for defining your problems or research question or even the methodology, or recognizing, identifying what factors you need to bring in your statistical analysis or models. It has been used in several cases, but it's not the only framework that you can use. There are wide variety of different frameworks that you can use. This is just an example. And then we have epigenetics, toxicokinetic, and toxicodynamics that are discussed in a different video, YouTube video. Please check it out. And then finally, we have EJ Screen, Environmental Justice Screening Tool, that we will touch more when we get through the in-person classrooms soon. But there is also a video on the additional materials in this topic on Module 9. So I have done interviews with experts in different populations, at-risk populations. Please check this out. Dr. Barbara Polivka is an expert in elderly. Dr. Antonio Hansen is in children. Dr. Luz Huntington Mosques is an expert in adolescent. And Dr. Hoffeling is an expert in pregnancy and maternal health. Also, I have done an interview with Dr. Dickerson regarding environmental justice communities as at-risk populations. And then I have Dr. Postma and Dr. Barbara Sattler for farm workers, and Dr. Thompson has been interviewed regarding low-income communities and Latinos. And finally, I have Dr. Halabici, who has prepared a very helpful presentation regarding environmental toxicology, where she discusses toxicodynamics, toxicokinetics, or epigenetics. Please check these videos out. They are located on YouTube, our YouTube channel, or on the additional materials in Module 9. Okay, going back to National Institute on Minority Health and Health Disparities Research Framework. This framework is a multidimensional model that shows a wide array of health determinants relevant to understanding and addressing minority health and health disparities. It facilitates assessing progress, gaps, and opportunities in the research portfolio. And it specifies that health outcomes can span multiple levels and includes a life course perspective component that emphasizes considering factors across the lifespan in determining health disparities. And also keep that in mind that there are so many factors that are included in health disparities. The list could be exhaustive, but based on the population that you choose, it might be different. So you need to adjust the component of the framework based on your population and based on the research topic that you have. Okay, here is what we have as the framework. So as you see, we have different levels of influence at the individual level, interpersonal level, community level, and societal level. And then we have different domains of influence, which happens over the life course: biological, behavioral, built environment, social, cultural environment, and healthcare system. And then eventually we have health outcomes. So the intersection between these cells or these different levels or domains can impact people's health at the individual level, or at the family or organizational level, or community level, or even population health level. So this framework shows the inclusion of different levels of factors in a health outcome, considering different domains. So why this is so important? This framework can be used as a vehicle to convey the NIH's philosophy and priorities for minority health and health disparities research. It communicates that conducting research entirely within one cell of the framework, including within individual biological or individual behavioral cells, which characterize a significant portion of traditional health research, may result in incomplete knowledge because it does not address the cumulative or interactive effects of multiple determinants. So you don't want to isolate yourself in the framework of one cell. You need to bring up different cells and you need to look at the cumulative effect and also interaction between those different levels of factors. The framework depicts the need for all attention to both biological and social determinants of health, rather than an exclusive focus on one or the other. So as you see, the framework is based on social determinants of health, and it goes along with it. So the framework recognizes both risk and resilience factors as the determinants in any cell in the framework may have a positive or negative impact on minority health or health disparities. Here is an example of utilization of this framework. So Dr. Alvidrez has recreated this framework for mental health disparities. She has plugged in the factors relevant to mental health disparities in each cell. To be able to create this specific framework for a specific topic, you need to have a comprehensive evidence review, literature review, to be able to see the connections, the significance between different factors in each cell, and interaction between different cells. And here is another sort of framework that depicts the social determinants of health in a different way. It has an emerging public health practice, and it has also current public health practice that shows how this might be different. It includes social inequities, institutional inequities, living conditions, risk behaviors, diseases and injuries, and mortality. So as you see, the NIH framework is not the only framework that you can use to formulate the factors that you want to include in your research question or the design of a proposal or research. Here is another use of NIMHD's framework. And as you see, this has been converted from a table and boxes to circles that can overlap. And so the concept map that you create might be different from the original one, but it includes almost the same factors. Looking at this, they have looked at, this is about vaccine hesitancy during COVID-19 and how they can improve it in youth, adults in South. So they have looked at the individual level factors and interpersonal level factors and also community level factors and how they are separate, how they are overlap. Here are a little bit more on the use of the Health Disparities Framework by NIMHD. You can check them out for yourself and learn more about the use of these frameworks. All right, so I'm going to stop here, and when we come back, we're going to look at pregnant women and children as pregnant women and fetuses, sorry, as one group of at-risk populations, and also elderly as another group of at-risk populations. See you soon.